you know that the women who were selected for the Women's Health Initiative hormone trial were asymptomatic? No hot flashes, no night sweats, zip zilch. Stay tuned to the end and I'll tell you the reason why. But here's the point of this reel. You're probably very confused when you hear that some people say hormone therapy reduces the risk of cardiovascular disease and others say it doesn't. The Women's Health Initiative showed a neutral effect on cardiovascular disease for the average woman 50 to 59 years of age. What about other studies? The Ms. Heart and Ms. Brain studies demonstrated that women who have persistent or frequent vasomotor symptoms are over 50% more likely to experience a later cardiovascular event in their life. Why do I think this matters? Well, if the women in the Women's Health Initiative were asymptomatic, it stands to reason that we may not have seen a reduction in cardiovascular events because there is a lot of emerging data that it is the vasomotor symptoms themselves and their impact on the blood vessels that predisposes a woman in later years to cardiovascular events. So, what if they had selected symptomatic women for the trial? Perhaps we would have seen a much more significant cardiovascular benefit. But in case you're wondering, why were the women in the Women's Health Initiative asymptomatic? Because hormone therapy is so effective for vasomotor symptoms, they didn't want the women to know if they were given a placebo or the real thing.